This conference will now be recorded.
Okay, everybody, good afternoon. Happy Monday afternoon. I hope everyone is well. We are going to go ahead and get things started. First of all, I want to thank you all for joining us. As we transition into doing online events and looking at subject matter that is relevant, I want to first give a shout out to Palm Point Behavioral Health. I know that as all of this was sort of happening early on, I started thinking about those topics that would be most relevant and most useful for folks in our community. And this one certainly was one that was top of mind as business people, as business owners, as leaders in the community. You're definitely dealing with a whole lot of different sources of anxiety and stress, whether it's about your own personal health or that of your family, but I know the health and vitality of your employees, their their livelihoods, and just anxiety about our community at large, and then our country, and our globe for that matter. So I really appreciate the folks over at Palm Point Behavioral Health for agreeing to do this webinar and help provide us with some tools that we can use each individually to manage the stress and anxiety of the situation. I know that even social distancing comes with a little bit of anxiety. I'm a self-professed introvert, but I find that not having one-on-one human interaction and face-to-face interaction is a challenge for me, since I'm so used to it. But I wanted to start out by thanking Palm Point for taking the opportunity, and I am going to unmute our presenter, and as soon as I can find you guys, there you are, and I'm going to turn it over to the doctor.
Hi, good afternoon. It's Tom Maley. I'm going to introduce Dr. Avalera, who is our medical director, who is going to spend a couple minutes talking about coping with anxiety and stress. I'm going to step out of the picture frame, and she's going to take us through some PowerPoint presentation slides that she put together that we're also using to educate staff and our patients. So hopefully the presentation will be extremely helpful for everybody. So Dr. Avalera.
Okay. Hello, everyone. Nice to be with you. Thank you for having me. My name is Dr. Avalera. I'm one of the psychiatrists and medical director here at Palm Point Behavioral Health. I put this together. I thought it would be helpful for the community, for everyone to know a little bit more about anxiety. The more we understand of why we're feeling the way we're feeling, the more we can learn and try to manage it. So I wanted to start specifically with, natural disaster and the definition of a disaster. I think all of us know and are living this, as the World Health Organization defines, it's a serious disruption of the functioning of a community or society, causing widespread human, material, economic, and environmental losses, which exceed the ability of the affected community or society to cope with using its own resources. I think this is, we're all living this right now. Some people are going to be more affected than others, but everyone is affected by this in a sense. And disasters, especially unpredictable ones like this, are one of the main causes of collective anxiety. And it provides a fertile ground for anxiety and depressive symptoms to come out. Some people that have never experienced depressive symptoms or symptoms of anxiety, this might be the first time that they're experiencing this. And other people that already have a mental health diagnosis, maybe major depressive disorder, generalized anxiety disorder, obsessive compulsive disorder, might present exacerbation of symptoms that might have been in remission, that, a condition that might have been stable. And there are some expected responses in all of us when we are feeling this type of stress. A lot of people are going to feel overwhelmed, uncertain about the future. Some people might be confused. They're going to maybe present fear and feeling numb. Other people might have episodes of crying, depressed mood. Some people might experience disruption in their sleep with nightmares. Some people might feel more irritable than usual and feel in a daze also. And some people just start withdrawing themselves and stop interacting with people in general. A lot of patients have described it as my thoughts are racing and I can't stop my thoughts. When I try to go to sleep at night, I'm thinking about everything that's going on. I'm thinking about how am I going to solve the issues, either the financial issues or the stress of not being able to interact with your loved ones or the people that you identify as your support system. That keeps a lot of people up at night. And when this happens, most people will exhibit what we call resilience. You can go to the next slide. Resilience is the process of adapting well in the face of adversity. Might it be a trauma, threat, a significant source of stress coming from either family issues or health problems. And you can also view it as normal distress that usually improves by assuring that you cover your basic needs, resuming familial structures and activities, for example, resuming your routines. But right now we know that with the stay-at-home orders and the social distancing that is required, doing our normal routines is also being disrupted. So things that you might have done in the past to feel better, like spending time with friends or spending time with family members, might be difficult or challenging at this time. So we have to accept and understand that we have to comply with the physical isolation, but we have to make sure to maintain and nurture our social relationships because these are very important. We are social animals by nature, and we need to be in contact with others to feel safe and to feel secure. So right now, this is a bit more challenging. And it's very helpful to understand your body. If you could go to the next slide and understand why we are feeling the way we are feeling. So that's basically the response of our nervous system. All human beings have a primitive system in which we respond to danger in a certain way. So years ago, when we were cavemen and there were animals going around, lions, tigers, you felt there was a threat, you have an automatic system that turns on. It's called the sympathetic system, more usually known as fight or flight response. So this turns on automatically when we feel that our lives are in danger or that there is a threat around us. And what happens when the system turns on? Your heart starts beating really fast to get blood to your muscles to prepare your body to either fight or run. So what happens? Blood is rushing out of your brain. So a lot of people might feel dizzy or lightheaded. Blood is rushing out of your gastrointestinal system. So a lot of people might feel like they're nauseous or they have a pit in their stomach or like butterflies in their stomach. And some people feel headaches. They feel pains, they start shaking. Some people feel like they can't catch their breath, like they're short of breath and they might have difficulty breathing. And some people might also feel palpitations or their heart racing. Emotional symptoms might include feeling overwhelmed, extremely nervous, experiencing irrational fear or a sense of detachment or impending doom. Some people describe it as if they fear they are losing their mind or they feel like they're going to die. And the fear is at times irrational, but we know that in current times there's a pandemic going on and our fears are basically warranted, but we have to be careful because when the system turns on, it sometimes it makes it difficult to make rational decisions. So that's why we have to try and implement techniques to decrease the anxiety levels. A minority of disaster victims are going to present acute stress responses, such as severe anxiety, distress. Some people might exhibit psychosis, which include hallucinations. But most people will experience the symptoms of anxiety and might also experience symptoms of depression. And some of those symptoms include, other than just changes in mood, feeling depressed and sad, your sleep might start getting affected. Your appetite might change. You will either lose your appetite or, on the contrary, start eating more. Your concentration might be affected. And these are normal responses to the stresses that we are living in today. And in addition to that, one of the things is one of the symptoms of anxiety might be feeling short of breath, or might be feeling like a tightness in the chest or chest pain. A lot of people are afraid they go to the emergency room because these symptoms might resemble those of COVID-19. So they want to get checked out by an emergency room doctor and make sure everything's okay. So that's going to be challenging both for people and healthcare workers, as it's probably going to contribute to increased visits in the ER. So how do we manage the anxiety? There are different approaches to this. There are obviously medications that we use, antidepressants, anxiolytics, if it gets to that point. There's also psychotherapy. There's different modalities that are used. You can do individual psychotherapy with a counselor or a psychologist. You can also integrate yourself in a group therapy setting, which we know that it's also challenging in present times due to the social distancing requirements, but there are options, and we will talk about that a little bit further in the presentation. And the fastest ones that we could use and the most effective ones are relaxation techniques, such as diaphragmatic breathing or deep breathing. Why does this work so fast and it's easy to do? You can do it from your house, and it activates a system in your body that automatically shuts down that fight or flight system that I mentioned, right? So it's called the rest and digest system. And when you activate that system, you slow the heart rate, you lower the blood pressure, and it produces a sense of calmness. And I included a slide, if you could go to the next slide, on the steps on how to practice deep breathing. It's something that you could do at home by yourself, and you don't need a professional to guide you through it. It's something that you can share and teach your family members or your kids to do. The best way to do it is just find a comfortable place, sit upright, place your feet on the ground, and close your eyes. Try to find a quiet place. You're going to start inhaling slowly to the count of 5 until you feel that your lungs are completely full and you cannot inhale anymore. After this, you're going to exhale slowly to the count of 5 until you feel there is no more air in your lungs. Do not hold your breath while you're inhaling or exhaling. It should be a smooth process and a continuous process. And if you continue doing this, it seems like a simple thing. Most of us breathe automatically and we don't fully inhale or fully exhale. But when you do this continuously for about 10 minutes to 15 minutes, you are going to feel your body relaxing immediately. A lot of people practice it 2 to 3 times a day, because the more you do it, the more you find time to do it, the more you control that fight or flight response that most of us have activated in general in this moment. Be careful not to hyperventilate, because hyperventilating or breathing too fast or too quickly might increase anxiety levels. All right, so next we're going to talk about some coping strategies to manage anxiety. We all have different coping strategies, and not everything works for everyone. So you have to try and find what works for you. There are positive coping strategies and negative coping strategies, so we have to try and focus on the positive ones. The First one and the most important one is get enough rest and get enough sleep. The recommended hours for sleep for an adult, 6 to 8 hours in a night. Eat regularly and drink water to maintain adequate hydration. When we don't eat regularly, our body starts feeling it, and some people experience increased anxiety. Talk to family members and friends frequently and discuss problems and worries with someone you trust. I know all of us have multiple concerns at this moment, maybe family members, friends, our children, financial stressors. And it's good to vent and to talk to someone about it. It doesn't mean that you're going to be doing this 24/7, but at least find the time during the day to reach out to a friend or reach out to a family member, someone that you feel comfortable talking with, someone that doesn't make your stress go up more. Discuss problems, perform activities that help you relax. So as I mentioned, not everything works for everyone. So you can take a walk, you can exercise, you can sing, you can pray, play with your children. A lot of family members didn't have, maybe because of a hectic schedule and because of work, we didn't have a lot of time to play with our kids. Now is a good opportunity to do so. You can also find safe ways to help others during the crisis. Exercise is very, very good. It's one of the top ones recommended in the list because movement releases endorphins in our brains and our body that relaxes and activates a system that makes us feel calm, and it's going to make us feel good. So it is recommended that people consider integrating in the routine exercising at least 3 times a week for at least 30 minutes. This is going to be real helpful. And as I mentioned, spend time with your family and friends if possible. Obviously, remember to follow the CDC guidelines and use social distancing. Make a new routine, adjust it to the current limitations. For most people, they're not going to be able to practice the old routine. Routines make us feel safe and make us feel comfortable. And when we have to get out of our routines, a lot of people experience irritability and experience anxiety. So now you have to create a new one, going around the current limitations. And it's very important that although there is a stay-at-home order, we have to try to at least go outside of the house periodically, at least once a day. It doesn't mean that you're going to congregate with a lot of people or that you're just going to go to a place where there's a group of people, but at least go outside, walk. Being around nature makes us feel better. Seeing the green and the trees and nature makes us feel calm. So it's important to make time to go outside. And studies show that our surroundings influence our mood. So while we spend more time indoors, it is highly recommended to modify it to make it feel more pleasant. So open spaces and natural light help maintain a sense of calm. So try to get rid of clutter as much as you can. You can use your time to organize your home. Try to modify the windows and curtains so that you get as much natural light as you can in your home. And also, as I mentioned, the color green helps us feel calmer. So consider, for those who like taking care of plants and have that natural ability, get a natural plant. If you feel like you can't take care of it and keep it alive, just consider an artificial plant. But as much green as you can get inside your home, that will be extremely helpful. Read a book or a magazine. Sometimes a lot of people have told me, I've always wanted to read this book and that book, but I can never do it because I have a lot of work or I have a lot of responsibilities at home or at school. So now is the time that you can grab that book and try to get through it. And now, trying to at least mention the negative coping strategies because these might exacerbate or increase the anxiety levels. They might be somewhat counterproductive. So choosing to sleep all day and not do anything until this passes is not going to be a good option. It's not going to be healthy for you. Working all the time without getting any rest, it's going to tire your mind. It's going to increase those anxiety levels. Isolating yourself emotionally from friends and family. As I mentioned before, even though we have to maintain physical distance and some type of physical isolation, it doesn't mean that we have to disconnect from our friends and our family members. Using drugs, smoking, or drinking alcohol. I know that a lot of people have resorted to drinking alcohol in this moment because they feel like in the moment that you use it, you might get a buzz and you might feel better, but long term, it's a depressor. So it's gonna make you feel depressed. It's gonna make you feel sad. And then if you create a routine around alcohol, it's gonna become an everyday thing. And alcohol, you have to be careful with it because you can create a physical dependence to it and you can create emotional dependence to it. And then you get into, maybe developing a substance use disorder that we definitely want to avoid in this type of situations. In terms of, let's say you try this, nothing works for you, you still feel anxious, you still feel that you're getting worse every day, just reach out to a mental health provider. You might need further evaluation, you might need further help. Some people might need psychotherapy or medications or both. And that is probably going to be possible if you get an assessment with either a mental health counselor, a psychiatrist, a psychologist. There are different clinics. So there are different levels of care in terms of mental health, and a lot of people don't know how to navigate the system. For some people, they might experience thoughts of suicide because when we are experiencing serious stress, our mind sometimes goes to that place. When it gets to that point, that's the most severe type of anxiety. If that happens, that is an emergency, and that is something that might require hospitalization in a behavioral health facility. They should seek emergency treatment immediately. If you feel like someone might be in danger or yourself, you immediately call 911 or the suicide prevention hotline, or just visit the nearest emergency room. So that's the most severe part of it. Another part that would require hospitalization would be getting to a point where you feel so depressed or so anxious that you feel you cannot take care of yourself or you cannot take care of those around you and cannot function. That would also warrant an evaluation to assess for further recommendations. And other types of mental health care include outpatient, which is the other extreme. You visit a counselor in an office, or you visit a psychiatrist in an office, and you can start psychotherapy or medication management. And then there's an area in between, which are intensive outpatient services. For example, there are partial hospitalization programs and intensive outpatient programs. That means that the person, as it were said, has intensive psychotherapy. For example, they could come to the facility 3 times a week, have group therapy, have interaction with a therapist, but they sleep at home and they do not have to stay in a hospital. For some people, group therapy, obviously maintaining the requirements and the social distancing recommendations. For some, group therapy is very helpful because they still have that human connection and they can still vent and they can still talk about how and what they're feeling and have someone respond back and say, hey, I might be going through the same thing you're going through. And another thing that I wanted to mention is anxiety and the media. I know today we live in a very technological world, and right now we are resorting to using our laptops, using our cell phones, the TV. We have to try and avoid excessive exposure to media coverage of COVID-19. Of course, it is very important to maintain and to be informed and keep yourself updated with the more recent recommendations. So I would recommend to choose the time of day in which you want to either watch the news or read the paper. But just try to avoid having the TV 24/7 on a certain news channels, because it's only going to bring up your anxiety levels. And in terms of social media, I always tell people to be careful, because it does have a lot of benefits. You can maintain contact with friends, family members, and the community, but it also comes with certain risks. You have the risk of increasing your anxiety levels and fear, because when you engage in social media, what you search for and what your contacts search for, they go into this type of algorithm, and it creates a feedback mechanism that it's gonna show you more of what you're looking for. So you're gonna get into this loop of, for example, if you're looking information about the coronavirus, or you're looking for information about the infections, it's gonna keep showing you more and more news that might be related to that. And this creates a constant loop revolving around what is causing more stress. So you have to be very careful about, false information, disinformation, and just make sure that you look for information in reliable sources. And to finish, it's very, very difficult and it's very challenging, but try to find a silver lining in all of it. Reconnect with your family and your friends. Usually this was limited for a lot of people, because we live in a fast-paced society and we have lots of work responsibilities. So this is the time to reconnect. Get to know your neighbors. Obviously, maintain the social distancing, but get to know those around you. Help others in need. And definitely spend time trying to live a healthier life. Exercise at least 3 times a week for 30 minutes. Prepare healthy meals. Read frequently and try to avoid social media as much as you can. And try to practice meditation and mindfulness. There are a lot of resources online that you can learn about what mindfulness is and about how to practice it. Now we have more time to read, so I think it's going to be useful to understand the type of techniques and practices that are out there. And lastly, get to know yourself. Try to identify the blessings in your life, be thankful, and you have now time to reevaluate what's important to you and what makes you happy in life. So just try to, the time that you have to yourself, try to get the most out of it. Try to learn as much as you can about yourself, so that you can try and manage the anxiety, finding ways that work for you. And just remember, you're not alone. We are all in this together. We are here for you 24/7 in our facility. If at any moment you or anyone you know feels like they can't handle this, we have counselors here 24/7 to make an initial assessment, and we'll go from there. We'll direct you to the appropriate resource and give you the recommendations that we feel might be needed at that moment. We are a behavioral hospital, but we also have intensive outpatient programs. But if we don't have the resources here, we will find a place or a resource that is appropriate for what it is you're experiencing.
All right, well, thank you so much. That was a great overview. And I noticed there's a couple of things that I made a note about is I've noticed that there's a lot of groups, whether it be a national or international platform, or even some of our local fitness centers or organizations are opening up and doing online opportunities for either fitness or meditation classes, etc. So I think that it's a unique time, because there's all kinds of resources available to us that maybe were subscription based or cost something, and at this point they're opening them up to the community at no charge, just to give people that sense of belonging and the ability to manage their health on their own. So I'm going to move over here. Let's see. Anybody have any questions that they would like to bring up at this point? I know some of you are on the phone. Bill, you got a question? What's your question?
Well, my question is, I thought it was very, very informative, Doctor. Working with young people, how should the teachers be positive with these young people? I'm sure that grown-ups are under a lot of stress, but young people see their parents and friends and being locked up. How should that problem be approached?
That is a great question. Thank you. Well, I had that same question asked recently, and I always try to tell adults, you know, young kids and teenagers, they know something is going on. They like to be informed as much as we want to protect them, because of course we don't want to always be in that state of stress or panic like a lot of people mention. They like to know what's happening. They don't like being lied to. So I always tell parents, try to be as honest as you can with your children, but I'll always maintain that sense of calmness. It is important that they know the risks and why we are having to make these drastic changes in terms of social interactions, so that they understand the severity of it. But always remind them that this is going to pass. This is only going to be temporary. We don't know specifically how long this is going to be happening for, but it's important to remind them this is only temporary, and we will go back to being able to play with our friends and hang out with our friends and spend time with our peers at school and see our teachers again. And they should validate their fears. If they express fear or they express anxiety, you shouldn't make them feel like they are exaggerating, or you shouldn't make them feel like the way they're feeling is wrong. The best way is to just open up the conversation and encourage them to talk about it if they need to. The more they talk about it, probably the anxiety levels will come down, because they know that someone is listening and someone is validating what they are saying. And just let them know that you are there for them if they need to talk about it. If they have any questions, you are there to answer them and keep them informed.
Thank you.
Anybody else got a question? I'm not seeing any pop up right now that I can see. Whoops, somebody just, whoop. Nope. All right. Well, I know that there's been a lot of really great examples of socializing in absence of being able to be face to face. I've seen some people actually having neighborhood, almost like block parties, but they're putting up 6-foot barriers, and they're staying 6 feet or more apart from one another, but they're actually socializing in groups just to get to know their neighbors and to spend time. I've seen some really creative stuff happening with celebrations. I mean, you can't have a birthday party, you can't have friends over, and so seeing really creative things. The teachers, I've seen where there's been teachers who they miss their kids. And so they're doing drive-bys through their neighborhoods and just waving at their kids and creating sort of a reverse parade of sorts, where they can just say, hi, we love you, we're thinking about you, and we know that you're going to get through this, and we can't wait to see you again. So I think that that's the beauty, the positive side of social media, is that ability to see what other people are doing, and that we can learn from them and do that. I know that we found that we're, somebody's not muted. Did somebody have a question?
Yes.
Go ahead.
Hey, this is Tammy Honig. I do have a question for the doctor. We know that this is high anxiety and stressful times for everybody. but we as professionals, when dealing with our members, they're under a lot of anxiety. Is there any words or phrases that we can use as we're trying to calm situations when, you know, people have to wait for a while to get the same type of services that they used to get instantaneously? And so just any words or thoughts about how, when we go to interact with different folks within the community and our own members, to help bring calm to the situation.
Well, yeah, I understand that's a great question. We need to show as much empathy as we can. Just let people know that we understand their frustration. We understand maybe that they feel irritated, or they might feel angry, or they might feel anxious, and we all go through those different stages. This is almost like going through the stages of grief. When we lose someone, we lost our routines. We lost our usual way of relating to others. We lost, for example, the ability to have things instantaneously for people. So I would say just acknowledge how the person is feeling. Encourage them to let you know, how you can improve or how you can do better, and just make yourself available to try to resolve or look for a solution as soon as possible for the issue or the problem that the person might be experiencing. And also remind them you're not alone. We are all in this together. We are all most likely experiencing the same emotions, just from different aspects. So I think that would be the best thing to do. Just let them know that you understand how they feel, and that it's not wrong feeling that way, and that you will do what you can to help them feel better and find a solution to the issue.
Thank you for that.
Thank you.
You're welcome.
Any other questions? I was just going to mention that we held our first power hour online on last Friday, and we realized how much we missed that face-to-face communication. And so we've set up every Friday at noon. We're going to start going online, just for people who miss that contact through chambers, through their other associations and organizations, just to be able to get together and talk about what we're doing, what we're dealing with, and try to support one another as a way to keep everybody engaged and keep everybody feeling connected. So there's all kinds of creative ways. I think that's the beauty of working with community leaders and certainly business people, is that they're problem solvers. And so when there's a challenge put before them, they try to find a way to find a solution. And so I'm really enjoying seeing some of the creativity that's coming to the table. So as it relates to all of this and how people are coping and making things happen within their own organizations. Bill, did you have another question?
I just wanted to say thank you to the chamber, and to inform everybody that we are using social GoToMeeting and Zoom with our students at the Valiant Air Command to run our STEM class. It is the way to go. Our society is changing, and there's no way possible that when we get out of this, which we will, it's going to change drastically the way we communicate, get along with people. I just want to tell you all, Marsha, you've been known you for off and on for years, but I love everybody. And the most important thing you tell children, especially today, as the doctor said, tell them you're there, support them, and tell them you love them. That's important. Thank you so much for having this, Marsha. And doctor, thank you for all your advice, and just be safe. And I still have a drink every day. Take care.
That's okay.
Not saying you have to give it up, but just make sure that you're aware. So okay, so we will make this available. I did record this, And so we will make this available on our website, and in future publications, we'll also go ahead and post it on social media for replay. So please feel free to share it with friends and family, anybody that you think may benefit. And I will, if you would like the slides, because I didn't require registration for this event, if you would like the presentation materials, please let me know. And you can just send me an email. If you send an email to info@titusville.org, we will turn around and send you the presentation that the doctor did, and so that you have them at your fingertips. And again, I want to send a huge thank you to Palm Point Behavioral Health and the doctor and Tom and his team for being willing to come online with us today and have this conversation and provide these recommendations. And I want to thank all of you all for joining us. Our next event is our luncheon. We are doing an online luncheon on Wednesday. Sorry, I can't feed you, but we will all be together, and we have confirmation from Senator Tom Wright, Representative Renee Placencia, and Representative Tyler Soroy, our state delegation for this area, and we'll be talking about the most recent legislative session, certainly coronavirus and its impact on the state and the state budget will be a conversation, but we invite you to register for that and join us online for that conversation. And then of course on Friday, we'll be doing our power hour at noon. So until we see you guys again online, I hope you all stay safe, stay well, and be happy. And if there's anything that we can do for you at the Titusville Chamber, please don't hesitate to let us know. Have a great afternoon.
Thank you, Marcia. Thank you for having us.
We appreciate it.
Thank you.
Thank you.